Hello, everyone. I'm Jim Garrison, and I want to welcome you to day 334 of Humanity Rising. Today is the 7th of October, and starting a few days ago, we began just to make people aware that between November 1st and November 12th in Glasgow, in Scotland, there's going to be the Conference of Parties, COP26, the 26th year that governments and corporations and NGOs have gathered together to deal with climate change. Given the fact that the Secretary General in August said that we are now in code red for humanity because the climate has reached a tipping point, and it is now no longer possible for the world to avoid escalating ecological turbulence. This COP coming up is being called the most important conference of parties in its 26-year history. So day by day, we're going to be talking about different aspects of climate change as we prepare for a 12-day Humanity Rising program between the 1st and the 12th of November. And I just wanted to bring in today that I was in touch with Bill McKibben yesterday, who you may know. It was Bill McKibben back in the early 1980s that was the first person in the popular press in an op-ed in the Los Angeles Times, actually, that named climate change as the most important issue for the human community. And he's worked tirelessly to that end ever since. And he's the founder, as many of you know, of 350.org, that was saying to the world that we have to keep our CO2 parts per million under 350 if we are to have any chance of survival. And we have just passed 420 parts per million. And that's one reason why this COP coming up is so urgently important, and why the Secretary General says that we are now in code red. We are now in a very incontrovertible climate tipping points. So that's coming up, and we'll be building our momentum and the various speakers and the agenda as we go along. But today we want to talk about health, particularly health as it's developing in Europe. But before we do that, everyone, let's pause as we always do, and let us just take a moment, just a minute or two in our busy, busy days, to just center ourselves in our bodies, close our eyes, and attune yourself to your heart. See if you can listen to your heartbeat just for a minute in a spirit of gratitude and deep thanksgiving that you're alive. We're all alive at this most extraordinary moment in the human journey. Thank you, everyone. Now, with an open heart and a heart full of gratitude and love for each and every one of you who are joining our session today, we want to continue our contemplation of health. We've been in the pandemic now for over 18 months, a little virus that not only won't go away, but is adapting very intelligently and superseding our capacity as a modern civilization to deal definitively with COVID-19. So the issue of public health, our mental health, as we've traversed an unprecedented situation of lockdowns and social distancing and mask wearing, which is unprecedented. Never before in the history of humanity have we collectively engaged in a series of lockdowns and enforced isolations and social distancing and mask wearing, as we're doing today over the last 18 months. So the issue of health is at the heart of our navigation through this pandemic. And we've been extremely privileged to have Lars Munter of the Nordic Health 2030 movement and David Somekh of European Health Future Forum to be convening a series of panels in a very thoughtful and multidimensional way for Humanity Rising. So without further ado, I'll turn it over to Lars and David with deep thanks for the thoughtfulness with which you've led our discussions on human health during this time of COVID. Lars, David.
Thank you, Jim, and thank you for welcoming us once again. With your intro, Jim, as a comment, very, very interesting thought about the relation between climate and health is, of course, that if we think that we have to solve the climate crisis because we want better health, that might be true. But it's also equally true unless we solve the challenges that we have in our health system, we don't have the resources to actually fix our climate.
Absolutely.
So it can be a chicken and egg, but it can certainly also be a matter of the fact that even though we have our focus on the big climate challenges and problems before us, it's interesting that these people gathering for the COP, the few, the powerful, they seem powerless to do anything, while what we can turn to are the many that has the agency to do stuff.
Well put.
So today, we're actually talking about, well, you, all of you up there, with the ability to do stuff, to make a change in your life, to be part of both transformations, innovations, be part of activities, be part of that change in health that we see. So today, well, bottom-up innovation. With our short intro here, well, we do know that we would like the strong and the powerful to do a lot, but it's amazing how much you can do without necessarily having a lot of resources. And at times, it even seems that having resources is not the problem. It's not the solution. It can sometimes even be the problem. David, also.
Thanks. Lars, thank you. Yes, indeed. And of course, I echo what you and Jim were saying. It's no accident that last time we had a session, it was indeed with environmentalists talking about their view on how climate and health interact. But innovation now, as Lars says, the means is there. We're very interested in how communities, people at the community level can change things, just as they have to work with people who have the sources of power and the money. But nevertheless, it's an interesting interaction. And I want to say just a couple of minutes about innovation, because rather than the 30-minute session, it's something we're fascinated with, both Lars and I, and it's really about understanding what on earth you mean by innovation, because innovation, the name suggests it's all about things that are new. But actually, of course, it'd be nonsense to talk about the latest color for autumn for fashion is an innovation. It's something new, all right. But innovation is really about new things that will actually change the way things happen, whether it's things that are more economic, or they actually facilitate things, or whatever. And indeed, you can go from things that would be counted as innovation because they're small improvements to what we call sometimes disruptive innovation, or innovations that have a major change on systems and the way things happen. And this is the kind of thing we judge. So we've been very interested in looking at how innovation can happen and be nurtured at a community level. And this is why we've asked our colleagues to come and talk to us, because we've been impressed by what they're doing. You know, we've done projects with the European Commission about looking at how innovation can assist improving healthcare, and of course tech is extremely important here. We know, for example, look at the iPhone as an extraordinary example of an innovative thing in terms of it changed the way we did a lot of things, just by the clever design of putting together a camera, a computer, and a telephone all in one device you could carry in your pocket. In terms of health, there are extraordinary technical innovations that have happened, such as, you wouldn't think of it, but being in the trade, the fiber optic endoscope, that's a very long name for a tube that you stick inside somebody that allows you to look at things and even to operate on them with minimum damage. When I was a medical student age 50 years ago, the only kind of devices you had like that were horrible metal tubes you used to investigate people's insides, or you had to open them up. Now, with this technology, it's revolutionized both how we do day surgery and all kinds. But nevertheless, that's fine. But tech isn't the only answer to innovation and improvement. And what we're interested in is people doing things together to change the way we do things. And I'm now using that as a platform to introduce our first participant, Jonathan Munter, if you'd like to turn on your screen. Jonathan happens to be in the UK like I am, and he also happens to be in the mental health field, which I used to be. But that's not the reason I asked him. It's because we learned about the work that he was doing for a large mental health charity, and Jonathan will tell you about his background and then about what they're doing. But what I thought was extraordinary, and I'd like him to share with us, is that basically he's set up an innovation lab, which is doing grassroots experiments as a way of demonstrating proof of concept, so that people higher up the food chain might actually pay attention and adopt them. And I thought that was fascinating. And it's really why I've invited you, Jonathan, as you know, to come and talk to us. So please, over to you. Tell us about yourself at first a bit, yeah?
Thank you, David. Well, I'm Jonathan. I'm Associate Director for Criminal Justice and Care Navigation at Rethink Mental Illness, which is a national mental health charity here in the UK. And as David says, I run I've got responsibility for a number of services throughout the country, and we're often commissioned to run services by the National Health Service in the UK and by private industry sometimes to deliver a service. They will give us a spec to deliver it to, but often in the delivery of that service, we see how it can be delivered better or in a more caring manner, if you like. So part of what we do at Rethink Mental Illness is also campaigns. We're a campaigning organisation to improve the quality of life for those affected by mental health. So that kind of drives us forward to where we can bring about influence, health influencing on the powers that be, to influence the people that do have the power to bring about system change. But we're also trying to bring about system change at every level. So instead of just going in at the top and engaging with ministers in government and the head of the NHS, we also engage people at grassroots level. And as you said, it's bottom-up innovation, if you like. So what we'll do is we will we try and think creatively, and we look at what innovation we can do to get proof of concept, if you like. Run a pilot or get a grant to set up a service, run it. It's very important to gain as much evidence of what impact and outcomes you're getting, because that speaks volumes, and then demonstrate to the system to kind of influence their thinking and steer them in the direction that we're wanting to do. And essentially, we've got a bit of an ethos that we're trying to create communities that care. We're trying through a concept that kind of breaks the mold a little bit by adopting an approach of generous leadership. We're looking at setting up place-based alliances to kind of coordinate and distribute community resources to best meet what the local need is. It might be a naive concept because it takes away commercial interest, so it's not the most commercial savvy route to take, because a lot of health providers obviously make a lot of money through the provision of healthcare services. But we think for the greater good, to bring about essentially communities that care and to raise the quality of life, it's best to try things new. So there's a number of things, a number of projects that we've done and are currently doing, which I'm more than happy to touch upon. So one of them, for example, is mental health navigators. So that's attaching a member of our staff who's trained in mental health awareness and also mental health coaching, placing them into primary care settings such as a doctor's surgery or a community mental health hub, and allowing them, they're non-clinical, to take some of the burden off the clinical staff, because often people presenting with mental health conditions, their underlying reason for their presentation is non-clinical. It's not that they've got a mental disorder, it's that there's something within their life impacting on their well-being, and if that something in their life was remedied, the presenting mental health issue would go away. So we're talking about things like stress and depression, anxiety, maybe associated to debt, homelessness, a whole raft of personal circumstances. So by placing navigators within these settings, they're able to offer a commodity that the system doesn't have, which is time. So they will sit down with an individual and take time to learn about what's going on for them, complete a holistic needs assessment, identify what the needs are in depth, and then basically advocate for them, accompanying them to any appointments that are needed, and using the power of the community. They do community asset mapping, and they will take a community approach to rallying everybody around that individual to help solve that issue. We're currently in the process of getting that independently evaluated by the Tavistock Institute on the outcomes. But even the health economic data that's come back already has shown that it's going to be beneficial to the system because of the number of do not attend doctor appointments that have helped, and with people getting outcomes earlier. So that's an example of one of the innovations that we've kind of created and that we've trialed within the system, and are looking at rolling out extensively across the country if we can. And it's certainly caught the attention of NHS England, who were starting to pay attention to it.
Well, look, Lars, I'm sure. Go on, Lars, you go first.
Yeah.
I was
well, my point here, Jonathan. Obviously, the National Health Service are set up to provide health services. We hope, but is it maybe because they fail to have an internal mechanism that can provide these innovations, being sort of blinded by sort of the fascination by their own structure, so that by definition does not have faults? How, or is it simply a matter of such systems constantly that they have to be challenged by an outsider willing to see things that they themselves can't see? How do you see your role in that? Maybe a catalyst that simply needs to be there?
To a certain degree, I don't think there's a lack of desire from some individuals within the health system to bring about innovation. I think they're hindered by the levels of bureaucracy that exist. So for them to, so another example of something we did was to introduce therapy dogs into a prison. We're also doing work with birds of prey within a prison. Now that's something that's quite left field. And for the National Health Service to do something like that, it would have to go to about a dozen committees and to be signed off and risk assessed. And by the time they got round to it, the impetus to do it would have gone. So they're quite happy. And the other perspective is it's taxpayers' money. So they would look at the optics to look and say, how's the taxpayer going to think about the NHS spending money running a project with birds of prey inside a prison that allows prisoners to interact with birds of prey, talk to them, whilst they're talking to trained professional mental health practitioners there about their general well-being and some of the issues that they may have, some of the low-level psychological issues that they do. So how would that sit with the taxpayer? So they've got more considerations to do, and in many respects, they're quite happy to fund in some cases, but not all of the case, but allow somebody like our organisation to come along. If it works well, they're quite happy to take some of the glory and say, yes, we commissioned that. If it doesn't work well, then it doesn't have any of their fingerprints on it, so to speak. So it's just, they enjoy working with us in some cases because we're able to mobilise a lot quicker. We can generate an idea, and within a week or two, we can be running with it. And I don't mind admitting that a lot of what we do doesn't work, but you often learn more through failure than success. And if it works, great. Then we've got proof of concept that we can take back to the National Health Service and ask them to introduce that.
An interesting fact, though, talking about economy. I suppose that most of the time, if not all of the time, you're introducing stuff that is essentially, I mean, they're creating well-being, better service, but costing, in a holistic sense, less for society. I mean, the point of what you do is not just simply to be a leech on society, rather the opposite, to make something happen that will, in the end, cost the taxpayer less. I mean, it's an interesting fact about the consideration of the taxpayer's money, that it seems sometimes not really to, that consideration seems not always to lead to actually spending less of them.
Yeah, you're very right. And another aspect to consider is the NHS are very, very wed to the clinical model, and a non-clinical intervention isn't deemed as, what's the right word, as prudent as a clinical intervention often. And it's a constant source of infuriation for me, in that we can get better outcomes for less money. So, for example, some of the interventions that we do with our wellbeing practitioners, the wages are less, the interventions cost less, even when we look at things. So, for example, some of the work that we're doing with the birds of prey or the therapy dogs in a prison, with properly trained staff are having better outcomes, and we're recording that. But when we bring it back, the NHS will say, no, we can play a clinical psychologist to do that, because they see that is our job to do that. It is our job to deliver and improve the psychological health of the individual. So there's a little bit of that as well. So I don't want to generalize and tar the whole of the NHS service with the same brush. You do have individuals who are more forward thinking than others, but you've got the bureaucracy, you've got the old way of thinking that they don't want to change, they're quite comfortable with it. And for large sections of the NHS, they are so mentally attached to the clinical model of delivery that anything else is almost like they can't compute. Sometimes they see it as just even the word holistic, they see that as lacking in evidence base, even though a lot of what we do, or the vast majority of what we do, is evidence-based. We go out of our way to evidence everything that we can do.
I'm sure David has a question just in a short while, but I have one more then, though, because when you mentioned the clinical model, I'm sure the NHS is not the only health system in the world that has a fondness of that particular approach. But is it then maybe also that is at the core? I mean, the fascination with a one discipline approach, to where that ideally, if you had a interdisciplinary model where you had sociologists, anthropologists, psychologists, a lot of other ologies attached, that would lead to also more innovation in itself. That is not necessarily the fact that you have a big organization. It's the fact maybe that you have an organization in many ways often run with a too narrow mindset, a lack of diversity.
Yeah, 100%. It's a lack of diversity in every sense, in the sense of professionalism, people coming at it from a different perspective, from a different discipline, but also a different cultural background, a different ethnic background. So again, that's something that we've recognized. You could argue that a lot of the institutions, certainly within Europe, have been designed and built by white middle-class men, and it's very much through those eyes that they serve. And there's inequality for gender, as well as race and ethnicity, cultural, religious grounds. So obviously that is an issue that's been addressed daily, but we've recognised that within our services. So again, something that we've introduced is, if you look at the workforce, often they're not very representative of the communities you serve. So if a lot of doctors are very highly educated individuals from middle class. They've had the money to go to university. They've had the money to become trained, but they may be working in a socially deprived, ethnically diverse community. So you've got your clinicians who look nothing like the community that they serve, and then sometimes that can cause troubles with relatability, empathy, etc., trust, building up therapeutic reliances. So we've created a scheme, and it's quite controversial because obviously with me working in criminal justice, the majority of our service users are convicted offenders. They're in prison, but we will identify prisoners even when they're still in custody, and we've got a pathway for them from service user to staff member, where we will cultivate that relationship, and we will invest within individuals, and on release from prison they can then volunteer, and then they can come and engage with us, where we'll equip them with we'll put them through and to get their education levels up. and we'll give them vocational skills, and we will train them so that they can ultimately become a staff member and sit in the room next to you and me, and sit opposite a doctor, a psychiatrist, whoever, and give them the confidence to be involved in somebody else's care from their perspective. And we're finding that's paying huge dividends at the moment. So, yeah, I hope that answers your question.
Well, it certainly does. David, a question before we introduce our next speaker?
Just a couple of comments, really. As I say, I was in the mental health field in a way you could say I'm a poacher.
You are the middle-aged guy they built it on. Right?
Not only that, yes, I'm a poacher turned gamekeeper, but in the sense that I rail against the paternalism of the health system as it stands and its brake on change and innovation. But the fact is, there are always seeds of innovation. Look, I was a medical student in the 60s when there was a methamphetamine epidemic in London, where I was a student, and I did an elective in a drug clinic where the staff were partly doctors, nurses, and partly ex-addicts. And in a way, because they you couldn't have your addicts, your customers saying to you, "You don't understand because you've never used," and all this sort of thing. So they're guys saying, "Yes, I have. Excuse me, mate." And that was actually, of course, it's followed through, hasn't it, in mental health with the notion of the expert patient, Sorry.
Sorry, David. I was just going to say yes. It is an expert by experience is nothing new. So in some respect, you can't say it's truly innovation. But one kind of bugbear of mine is that often it's tokenistic. So for example, in the substance misuse field, often they'll get somebody who's been addicted to hard drugs, heroin, for example, for many, many years and has managed to get themselves clean. They'll then be held up and as an example and rolled out as a peer mentor or some other thing. But it's quite tokenistic, and it's often that individual's not given the right wraparound support. Sometimes they're asked to do it on a voluntary basis, or they're not paid the same rate as a normal clinician would be. So that's something that we're very keen to address. Just because you've experienced something does not mean you're the expert in it. So if we're asking somebody to be able to work with people with mental illness and to get them through an episode, or to improve their day-to-day functioning, and to able to put them in contact with all of the relevant organizations, they've got to be able to win the trust of the service user, but they've also got to be able to interact in a multidisciplinary environment with a doctor or a psychiatrist. That's a certain skill set, and not everybody who's had a mental health condition will have that skill set. So it's important that utilizing experts by experience is essential and needs to be done, but it should not be done in a tokenistic manner. And sometimes it's almost bordering on exploitation when you're using it as a source of free labor. So you can bulk up your workforce with ex-service experiences. So somebody who's had a drug addiction, or somebody who's had a mental health. And I've worked in substance misuse for many years as well, and it broke my heart because I saw it so many times. People who, with the best will in the world, wanted to be a sign of visual recovery, but they just weren't emotionally equipped to sustain it, and often would fall back into substance misuse, or often some of them would still hold pro-criminal beliefs, so they might be clean, but they would still be offending, which again wasn't the best role model to have, but they were essentially being exploited.
Yeah, look, couldn't possibly disagree. But look, I think the thing is that we've talked about health literacy before in these sessions. And what you're talking about is that too, isn't it? That we recognize that just as health professionals think that they know how to deal with their customers and they communicate well. Actually, they need training they didn't realize. Similarly, as you say, it's totally unfair to pitch in someone who's got lived experience without giving them the training and support to be effective in what you're asking them to do, and equally respecting them by recognizing that they need some kind of compensation and so on for doing it. So you know, what you're talking about is the whole essence of innovation for me, which is there are elements of the future sitting there, but they're not connected up enough to have the impact we want them to. And just a more general observation before we come to our next speaker, you know, again, I was reminiscing about my time as a medical student, what was different apart from the fact that we had needles that were like an inch wide, you know, and it was really awful. You just have blood taken, and now all that's been dealt with. But actually, the way that care is delivered in a hospital isn't very different at all 50 years ago. And that's partly because the innovations that's needed, and we all recognize it, that putting more emphasis on a holistic approach, more emphasis on prevention rather than just sickness treatment, it hasn't penetrated the system enough to undermine the traditional paternalistic thing. However well-intentioned people are, it's a huge battle, but it's interesting. So there is, just like slow food, there's very slow innovation sometimes, but we have to keep it going. But look, I'm talking too much. Lars, let's introduce our next participant. Yeah.
Well, yes, our next speaker, and if you can turn on your camera, Yvonne, is Dr. Yvonne Prinzellner, coming or participating from Vienna. And especially some of the points that Jonathan had just before about diversity, about respecting people with a lived experience. And so these are issues that you've worked extensively with. And also the other topic that David mentioned before, using that then to generate knowledge that might lead to innovation, that might lead to change, and also lead to better communication between people. But Yvonne, please introduce yourself and your work.
Yeah, well, I'm Yvonne and I'm a health communication scientist. So I kind of look at things a little differently than Jonathan does, like less on the too practical side, more on the meta level, so to speak. And I'm very much in my research concerned with vulnerable groups online, taking a closer look at laypersons in the field of health and how they communicate online with each other, and how empowerment and social support can really then lead to positive outcomes for them when it comes to the health issues. So that's me in a nutshell.
Indeed. But when you do that, I suspect that you experience again and again both that these lived experiences point to certain challenges within either society, within a system, that they are, well, without being disrespectful, certainly, of them, but they are really canaries in a coal mine in identifying some of the challenges that they see, that we feel, that since they're experiencing all the hard edges or corners of a system and being hurt by them sometimes, they're also very effective at pointing out things that would potentially be good innovations, be good changes, or so on.
You know, it's interesting because we've been talking about innovation the whole time. I've just been listening in, like, innovation, what is innovation? We keep asking ourselves this question. And, you know, like these days, everyone has to be innovative in one way or the other. And I always experience, like in my own work, you know, when I'm trying to work on an innovative project or come up with an innovative research idea when it comes to health, and empowerment online, what you need for good innovation to happen is time, because you need to be creative and you need to be able to, just really explore the field that you're working in. And that's what I realized with the different groups that I'm looking at in their online communication in terms of health, is that if health professionals, policymakers, people who could really change something in the system, shift the system towards a more, an equal state, of us being equal people, they would need to listen in too, take the time to really take a closer look at what the needs of people with, let's say, chronic illnesses really are. It's one thing to go to your doctor and tell them about the problems you have or the new therapies that you're going to be undertaking, whatnot. But online, when you watch YouTube videos, channels of people who talk about their illness and what they go through in their day-to-day life, what they're scared of and how they deal with, the fear of, let's say, for example, dying or undergoing therapy or whatever, then you might find ways as a health practitioner, better ways to communicate with people, and maybe better ways to deliver the messages that you want to deliver, and maybe also have more impact when it comes to prevention, right? Just listening in. That's, to me, this is also like innovation at its core, actually, taking the time,
Listening. I suppose one of the things that you've been doing quite a lot, David, and also spending a lot of time doing so.
You could say that.
Yeah.
I must say, one of the things that strikes me is it is interesting. You're making a very fundamental point there, of course. It is something, interestingly, that in the UK, they've now got a new project. Well, it's not new, but it's becoming, they're pushing it hard through the system, is that health practitioners are being taught to think about saying to their customers, if you like, not what's the matter with you, but what matters to you. And it's that switch of emphasis, isn't it, from the traditional handing down the tablet one to looking at people's needs. I think in the field of particular, and it's a big field after all, a big portion of our healthcare costs go on supporting people with long-term illness. It's more than ever the issue about what are people's needs when you're designing change, isn't it? So I have colleagues who make a very nice point, having chronic conditions themselves, that you go to see the clinician, whether it's a nurse or a doctor, whatever, for review of your condition. And they look at you in a totally blinkered way, in the sense of what are your symptoms doing and so on, not how's the rest of your life, And it's a source of frustration for quite a lot of people, because it's not what matters to them. Sure, the symptoms can be controlled or not, but if they're bloody miserable, or they've got other problems which are really making their symptoms worse, it's almost like the health professionals aren't tuned to think about those factors. But look, the important point you made about time, though, is it's also about design, isn't it? I mean, it's about, I think one of the things that, again, we've talked about design in previous sessions, that one of the things that can happen, it's the top-down thing, isn't it, is that people design things. It's like the Muppet Labs, if you remember, that the mad scientists produce this thing and then they sell it to the public or whatever, rather than actually asking the public what is it they need. And that is a thoughtful process. It involves in good co-produced projects, it involves spending a lot of time talking to potential users of something you're going to introduce about how they would use it, what it matters to them, and so on. Do you have examples from your own work of that kind of thinking that is being applied?
When we're talking about, I don't know exactly which way you want me to go there now, because I can give you examples of how communities share their ideas, or let's put it that way. When you're looking at online communication and then you're thinking of health, there's obvious channels that you might pick, right, from health professionals. And then there's channels that are not so obviously branded as health, right? Where you would not think that there would be anything hiding that has to do with health. And you can reach people there that are actually not thinking about health topics so much. Like, say, for example, the younger audience. I will give you an example. I looked at this one YouTube channel, and she was a beauty YouTube, actually. She was talking about makeup and all that stuff, like how to use the eyeliner and I don't know what. And then she got cancer, and she made that public on her channel. And what she did then, and she had like an audience of, I don't know, 15 to 20-year-olds, right? Who were not really thinking about such a chronic illness per se. That's not something that's, part of their daily life. And she started producing videos about, let's say, her new hairdo, because she lost all her hair during her treatment. Or like how she does her eyebrows now, How's the best way to do your eyebrows, when you got no eyebrows anymore? And she was raising issues with that younger people just wouldn't have thought of, if they just wanted to get some makeup tips, for example. And you can see in the comments, and that's really interesting, you can see in the comments, social support is happening. We're always talking about hate speech and, people being attacked on. Yes, that happens, and it happens a lot. But I can tell you, especially when it comes to those social media outlets, the smaller channels, the smaller influencers, so to speak, they do have a community that really supports each other. Sometimes people just stumble upon a YouTuber that they like. They have some kind of parasocial relationship with, they just like the person, and the person gets cancer, for example, and then all of a sudden you become aware and you meet other people who might have gone through other illnesses that might have changed their life, and then you exchange each other in the comments, and you find a new group of people which you would have never met in real life, and that's such a resource that is being overlooked so much, So this is, I think, one of the things online where, to me, this is like, when it comes to health innovation, at least that's the way I would look at it. That's where it happens.
That's really
question,
interesting.
though.
Lars, yeah.
Yes. Of course, looking at vulnerable groups, you can often think, that there's a need for a special design to meet their special needs, because the vulnerable groups need some extra care, some extra whatever. And to go back sort of to my point about the canaries in the coal mine, sometimes when we think of vulnerable groups, we're othering something that's also within ourselves. Most people are in a vulnerable group. They choose maybe not to define themselves as that, but are often more vulnerable and either they choose to admit or that they're really aware of. So some of the vulnerable groups, I think I'm leading on to a question at some point, but forgive me so far. But that the vulnerable groups are just better at actually recognizing that they have a challenge, whereas others are going a little bit blindly through the daily life. But when we either talk within the pandemic or outside, it was a huge surprise to, I guess, in the pandemic, just how many were actually in a vulnerable group. And in percentages, you could slowly sort of tally up that it was pretty close to 100% that were in a vulnerable group. So can you also sort of extrapolate from those vulnerable groups, not just to see how you might redesign or innovate for them, but redesign or innovate for all of us?
You know, I think it's, first of all, I'd say we are all vulnerable at one point or the other, you know, all of us. The beauty or the fascination to me of online communication to that extent is that there is something there for everyone. And you don't have to actively engage, right? You can just lurk and read and still get informed and still find your community. You do not have to shout it out that, you know, you might be dealing with something that you don't want other people to know, right? But you can still find help online, and you can still find a place where you belong online. It doesn't solve all the problems, mind you, but it is a very, very important resource in my experience to have, and just to know that you have it. And like I mentioned before, I think the most important part would be, or like a first step, for example, would be to acknowledge that these communities exist, right? From policymakers, for example, from other stakeholders, just acknowledge that they exist, acknowledge that they're there, and then maybe, like I said, listen in, look at the things that they're producing, look at their needs, and then maybe, as a next step, try to cooperate with them. You know, because these people, Jonathan, I think, said it so nicely before, you know, these people are experts in their own way. They might not be medical experts, but they are experts. So you better listen in, because it's their life and it's their problems they're dealing with. But they're just, you could call them like testimonials for so many other people having similar issues, right? So I think we should all kind of take this more seriously. This is one of the reasons why I really try to, also in my research, point that out over and over again. And when I talk to people and my students, for example, that it's important to embrace the diversity that we have. And it's beautiful that we have an outlet for it online, you know?
Mm-hmm. Very interesting. David, you have a question?
No, it just to really follow up something that really caught my attention. Yvonne said, because I was actually going to ask you. So how? Sorry, there's a small child just entering for a second. Go away, you. I'm busy. All right. I got distracted now. One of the things I was going to ask you was about your how you feel your research could itself help bring about change. But just as a second question, so I'll dump two on you at the same time. I thought that what you said was fascinating because it's something that I've wondered about before, you know, the richness of the chatter, if you like, on the internet, and, you know, the diverse stuff that's there. It surely can be used to change the way we look at things from our top-down systems to engage people more. I mean, that's after all the whole theme we're talking about here, bottom-up innovation, is recognizing the power of communities potentially. At the moment, the internet seems, and social media seems like a bit of chaos, you know, where there's just everyone's milling around and then they form little groups, as people do, you know, socially. But there's no sense of how much they could come together to bring about social change we so desperately need. I don't know, maybe it's just making it too organized. You know, I don't know what balance there.
Yeah, I think, you know, honestly, that is that's what humans always tend to do, is like trying to bring structure into something you should not start or try to control, right? Because then people will find other outlets to communicate about, say, health-related issues that the public cannot look at anymore. And that's where it kind of gets dangerous, as soon as things start flying off the radar. So I think sometimes it's worth just accepting that, as you coined it, chaos, right? But what I would suggest also, because I've been concerned with that topic too, and it actually goes hand in hand with my research, so to speak, listening in online and just really taking a look at the different groups. You do need competence for that, right? You do need to know which platforms you can utilize for what, where you can state what without, because there's like lots of dangers involved there too, right? You could start a major discussion where you don't, you destroy your image or whatever, and the internet does not forget. And these are the things, or you could not even sometimes people don't even know how to get into those groups or where to look or what to do, Honestly, I've been in preparation for a lecture that I gave. I once typed in on Instagram the hashtag cancer, right? I got over 15 million hits, I think, back then. That was 2 years ago, So if you know how to look for information, or if you know how to look for communities, you can find them. But that's something you have to learn. And that does not just concern, because most of us might have in mind the older generation now. It's also about the youngsters. The youngsters, they might be able to, use tablets way quicker than I would be, if you gave me just a random one, right? But that's not media competence. That's a technical skill. It doesn't say anything about how you can reflect online and put your thoughts out there. And I think especially in terms of health, that is so very important to have a sort of digital literacy in order to make yourself heard if you want that, or in order to seek and gain the information in terms of health that you're looking for, right?
Yeah, I mean, digital literacy, no question. I mean, it's part of, it's what we have to teach our kids, isn't it? I mean, as much as anything else. I mean, as you say, they're very, very facile on the toys, but whether they're really able to get hold of how they can use them best is something else. But look, Lars, do you think we should ask Jonathan to join us, shouldn't we?
We should indeed, yes. And also from the basic point of Dr. Yvonne here made a very interesting point, of course, about the power of innovation by actually listening to people, which is, I mean, sometimes when we think about the medical model, a very basic point that you may actually learn a lot from. But Jonathan, please, reflecting upon what we've just talked about here, how do you also then use, for instance, the use of the dialogue between people, the chatter, in some of your work as well?
I guess the chatter, if you like, it's all information, isn't it? And it's about how you process that information, and how you process it appropriately and you don't get distracted by it, because it can be indicative of trends. So it's important to monitor. So I was interested in hearing that, because we are very conscious that the world that we live in is changing at a speed technologically faster than at any other point in time. And that in itself is anxiety provoking for a lot of us, certainly with children who seem to be more technologically savvy than us, but also the way they get their information and the sources of they get their information are very different to traditional sources. So the very fact that I sit and watch the news through a television is quite archaic to my children, who get everything from basically their phone or an iPad. They would go to YouTube before they would go to the BBC website, for example, and because it is unregulated and often unmonitored, there are dangers in itself. So it's something I think that a lot of us within the industry need to do a lot of catching up on, about how we reach the right people, and how we engage appropriately. We've made some steps. So, for example, we've provided a free online community support for people with mental health issues, where they support each other, and it's moderated. So, for example, a lot of people who've gone onto platforms such as Facebook or Twitter, they are often, if you've got a different opinion to somebody else, they're often attacked, and for some people, they're not emotionally resilient enough to deal with that. And you'll see the well-publicized sites where, and again, in the UK, there's been a lot of publicity recently where teenage girls have been taking their own life after visiting certain sites where they've been encouraged and told about how to commit suicide, etc. So that's a concern that we've got. So a lot of these platforms, despite what Facebook and Twitter and the rest of them say, aren't moderated as strictly as they can be. So we've got volunteers who will moderate and remove any such material where you're encouraging somebody to take their own lives, etc. And again, we're getting positive feedback, but it's early days. As Yvonne says, it takes time. Innovation, it's about sowing seeds and learning from others, observing what's happening. So I guess from our perspective, and me personally, that would be an area of weakness for the industry in whole, about how we communicate. And if you think about it, we're up against some insanely intelligent individuals who get hoovered up by big tech, like Apple, Facebook, Amazon, etc. The best brains in the industry, if you like, are going to, not into health, but they're going into technological firms because they're able to pay the funds and influence people. It's a huge field, yeah.
Look, I think.
Sorry.
No, you first go.
Speaking of a group of people that can really have a hard time in actually navigating modern media and understanding how to, talk to each other and others. Of course, I'm thinking about doctors here, but sometimes, if you look at statistics, you also see that they're underrepresented when it comes to users of a lot of these different media. So in addition to the skills that they may need to actually do that, it also means that a part of the conversation of those media are disproportionately not including this discipline. And then they turn, as Yvonne mentioned before, to good lived experience advice from a YouTuber who's, now gotten a cancer diagnosis. But over time, I guess it's a question to the both of you. Can we also, I guess that would be a yes, but how can we slowly then also get some of the more disciplines in using the media where people are? If you don't know where to find good medical advice or good psychological advice or good any kind of advice, you turn to the people who's there. So is there also simply an accessibility challenge here, that the doctors forgot that people went somewhere else, and and instead of just answering opening the door and waiting for them to arrive in their GP practice, they should actually go and talk to people where they are.
Yeah, Lars, I agree totally. It's services that it's almost assertive outreach. So you're going out into the community to engage with often the most disadvantaged, most marginalized members of society who don't often or like to engage with some of the statutory health services. Yeah, there's definitely a need there, and you've got the digitally excluded, something during COVID where one-to-one, face-to-face services were temporarily suspended. We noticed a lot of our clients were digitally excluded. They didn't have a smartphone, or they didn't have access to an iPad or a laptop tech. So how do you engage with those? So that's another issue to be thought about and addressed. And then when they do have the tech, how do you divert them into the right fields?
Yvonne, do you have a comment?
Yeah, I think an important issue here would be, and it doesn't really matter what age we're talking about here, or age range, and what health issue and whatnot. I think it's always important to, and this is also what I find over and over again when I'm conducting my studies, and talking to people. You need the peers, right? You need the people closest to them on board, face to face. I'm not talking about, you can't just throw them in there and say, okay, use this device and then surf around the internet and just do whatever, get your information, or go to this and that doctor. You have to use the spirit that they have amongst their friends and peers, right? Because there, they can say, okay, I don't know how to do this. I don't know what that means. They can talk to them. They feel free, and they can educate themselves, especially when we're talking about people who might not be that well educated, or who might be dealing with language barriers, for example. Go to the smaller communities, and find like one or two gatekeepers, and kind of, work with them, kind of, yeah, like light a spark, That's what I would say. That's the most important thing.
I think the other thing, sorry, Lars and I we don't normally do this. We keep tripping over each other. It's obviously we're both fired up by this subject. But
sorry.
Look, we're both as bad as each other. Look, I wanted to make a general point that you actually attracted me to when you were talking about chaos and so on is, of course, the other lens to look at this isn't about directing people to health or whatever at all. It's about safety, and we're actually talking about well-being. And if you ask, you're doing happiness indexes and so on, apart from having enough money, accommodation, good relationships, safety matters to people. And at the moment, although our governments, for example, are paying lip service to try and make the internet safer, and there are obvious examples, Jonathan gave one, and you talked about hate speech and so on, the truth is that if our streets, particularly in our comfortable, relatively comfortable, well-off Western Europe, if our streets were as dangerous for people as the internet is, there'd be a public outcry, because now, obviously, it's not about policing. That would be daft. I mean, they can do a certain amount of policing, but there's always the balance between freedom of speech and so on and so forth. But what this is about, surely, is about giving people the tools to cope, to manage, helping them be safer. And this kind of, so you talked about digital literacy earlier, and we all agree, but it's actually much more than that, isn't it? I've said this before, I was really impressed by someone who came onto one of our webinars a few weeks ago from Finland, who was talking about, how they teach mental health resilience in schools, for heaven's sake. Good for them. They're actually getting the idea that people need educating to help themselves, to deal with everyday stresses. You don't just make an assumption. As you said earlier, we're all vulnerable. We know that. And of course, there's a certain kind of culture that aims to deny vulnerability, even aims to deny that death is inevitable, and just wants to have fixes all the time, for health things, rather than recognizing nature. But this thing about thinking as a whole society, surely we need to be able to know how to be safe or safer on the internet because it's such a big part of our life now?
Safer, you know, that's I get criticized quite a lot because I tend to be very positive when it comes to, you know, the internet and all that. So it's like most of the people, when they talk about the internet, and especially in terms of health, right, the first things you do is you look at the negative aspects, and it's all dangerous, and it's all like, yes, it is. And you should know what the pitfalls are. But it's more of knowing that health is something holistic, right? It's not just as soon as something is happening with your body, something's wrong and you get a diagnosis, okay, that's it, right? It's more about a holistic approach to things. And I think that the online outlets and the different platforms, and they're very differentiated, right? You know, there's lots of them being used for lots of different things. They offer a place where you can look at health in a very holistic way, you know? I know of channels where they talk about skin picking issues, you know, and then they talk about how to treat the skin, and in the same video they're talking about mental health, but in a very, very nice way, you know, making it understandable for lots of people, right? And you can only learn how to protect yourself if you learn how to navigate in this world. Meaning, you know, I think we have to work more on not being so scared that something might happen, but knowing where to find our community online, right? And using, because there's also something like solidarity online. One might not believe there is, but there certainly is, especially in rather tight-knit communities that are concerned with health issues.
Not just health issues. I mean, I have a daughter who's is in a big Facebook group about women who work in wood, and so for them, solidarity is a very important issue about you know, helping them carry on. But look, Lars, Jonathan, join the conversation. Come on.
Well, my comment before really was, or the comment I tried to make was about when we have major shifts in information technology, we also see a number of other changes in society. One of them I was struck by before, and I'm not diving into the challenges of I guess religion in general, but when Gutenberg, of course, made it possible to distribute books, knowledge in a new way, it made information more democratic. It made it possible for people to access knowledge directly without in an intermediary, i.e., of course, the priest in that age. But it also led to a huge leap in, well, public health in our societies, not without some birthing problems, you might say, but at least in the end. So is that sort of also on the table here, the realignment of a democratic access to information that then leads essentially to people being healthier because they can support each other, they can access information better, they can understand how to navigate. And so is this a part of a solution for, well, democracy? I'm being philosophical today.
No, it's just a huge question. Like, how are we supposed to go about this? Yes, of course it is. But it can only be, I mean, I think it's just, as long as we're talking about people who don't have access to the internet, who are not able to be online and read those things, we can't talk about democracy, and we can't talk about, you know, everyone having the equal chance to inform themselves. But yes, it's a nice
in
idea.
But in the old days, surely, I mean, not everyone could, well, read. But still, it was a good idea to innovate and print books, wasn't it?
There was a much richer communication within societies. I wanted to bring in Jonathan here because it was something we got diverted quite recently, but linking with what Yvonne's been talking about a bit in terms of solidarity and the power of communities. I'm really interested in the work you do, Jonathan, because it goes back to when you talk about your community navigators. After all, whatever the tech we've got to support this is really back to very traditional ways of reaching out to people within your community and supporting them and making connections, just like traditional communities, smaller communities looked after people with a disability, or they cared for them in usually quite often in very constructive ways, just by being kind, or thoughtful and so on. And I just wondered what you feel you learn from the kind of work you're doing in communities about how we can facilitate that and re-engage people in communities, because it's like it's there, it's latent, isn't it? It's there, but somehow the way society is functioning at the moment doesn't allow it to flourish as much as it might. So we have to kind of encourage, this is again back to the bottom-up thing, isn't it, of making it happen locally. I wonder what you think.
Yeah, I agree with you. Obviously, I mean, it's a bit of a strap line, but communities that care is what we're after. And I've noticed from some of the comments as well about online communities, and that's equally as relevant for online communities. One thing that I've been struck by has been some of the individuals within these communities that we're seeking to help are completely unaware of everything that community has to offer. And it's only, and again, going back to social media or the internet, it's the same. You're often unaware of what help and useful resources are out there unless you're guided and taken to them. So the traditional view of your local community coming to care for the ones that need the help at that time, wrapping their arms around them, lifting them up, supporting them in any which way they can, whether it be financial, a roof over their head, or just giving them a helping hand day to day, is what we would like to see. Some people think it's a little bit of an old-fashioned perspective, looking backwards with rose-tinted glasses, how we think society used to be. When you see, everybody looked after the neighbours before TV existed. Everybody, new neighbours were greeted with a pie and a welcome to the neighbourhood kind of thing. We do get told that people do feel isolated now more than ever, because with the internet and with social media, you can satisfy the urge to meet people and interact with people without even leaving your bedroom now. You can do it from your handset, so you don't have to leave. But they're disconnected from the physical local community where they work. So yeah, it is a huge philosophical debate to have around the benefits of community and what that means, because having a sense of community means different things to different people. But I guess the bigger picture thing, and breaking it down to the most basic, is we're encouraging people to live in a community that cares, and by putting in navigators, whether it be online, which I think is a very good idea from some of the chat I've seen, or in your local community to help you navigate through some of the pitfalls and navigate you to the services that you need, it is a good thing.
We are also in the chat. There's of course, a conversation about how some of the points that I made, I'm watching myself, that some actually think of the similarities between the information technologies of 500 years ago or so, and now. But also a point about how the system that you make, Jonathan, that it also has potential to maybe be utilizing some of these modern technologies to be expanded much more, building digital versions of what you do to reach more people by doing it. How do you think? I mean, is there a sort of would your only role be to fix challenges and then have the digital thingy on the side, or is this also a potential for you as well, as soon as you navigate how to build systems that can do that in better ways? We've learned a lot during the pandemic, surely, about doing stuff online that we never imagined could actually, well, some imagined, but most of us didn't use it anyway, that we could do. Is this, are we on the cusp as well, doing something similar?
That's a big question, and I don't know if I've got the answer. I think, and again, this is a personal observation, I think with the pandemic, it did push us more online, and we did prove that us organizations, we can engage with people without doing it face-to-face. However, I do think there's a little element of not being guilty of celebrating the emperor's new clothes, insofar as when society is starting to return back to normal as it is now in the UK, it's amazing how much people have missed face-to-face contact, and actually people have felt that going onto Zoom and Teams for the meetings, they've lost some of that personal touch, and some of the conversations that you would have pre-meeting, you know, they classify it as the water cooler moments, but some of those interactions have been lost as more and more people have moved online. So I personally think there's a balance between the two. I think using online resources to further the work that we're doing is 100% the way forward, and the pandemic, if anything, has proved to more of us that that's possible. But I don't think I'm qualified to talk about how we could properly achieve that.
Well, I don't think any of us are, but it's worth throwing some ideas in the pot. I mean, from our experience, I like very much something Yvonne said about using the idea, just putting it very crudely, I mean, the idea of professionals turning to the internet to get help in doing things better. I mean, it's a much wider issue, isn't it, about having a healthier society, isn't it, about connecting bits. You know, so much of things that don't work well in society, whether it's the health ecosystem or other parts of society, are because they're siloed, they don't connect properly with each other. And this is like the apparent blindness that some industry has to what it's doing to nature and the quality of people's lives. And it's a question of how to start bridging those gaps, isn't it? So just like health professionals can learn from understanding what's going on the internet, after all, is somehow like a monster that's been let out of Pandora's box, and we still don't know quite how to manage it. We're learning, you know, but it's an uncomfortable experience. But it brought to my mind, I've got a dilemma currently about talking to a big Japanese pharmaceutical company. They wanted to know more about what's going on in health policy, right? Now, it seems to be a diversion, but actually it's about talking to the enemy. You know, and I was talking to their PR people and saying, look, we've always in health think of big pharma as the enemy, the big bad guys who are ripping everyone off. And sure, they make the pills, but then they're just screwing us, you know, and it's just appalling. And they make the excuse that they need all this money to develop more goods and so on, but they're not actually doing it. But the fact is, we need to work together with these guys, or find some way of working with them, because just like none of us are all bad, even if they're mostly bad, the truth is they're important players. We have to somehow find a way of making a relationship. This is something about global politics, isn't it? That you're going to have to work with. If you don't work with people, then you get bad things happening even more. I don't know.
Which is another needed perspective on how to produce bottom-up innovation, I suppose, David. Working with people that you might not usually work with. But I think maybe, though, it's time for us, David, to thank Yvonne and Jonathan for their patience and for their willingness to answer our philosophical questions, practical questions as well. And then turn over to our friendly host, Jim, again. And thank the audience also for their many good comments and reflections during this conversation.
Thank you, Lars. Thank you, David, Yvonne, Jonathan. A very illuminating conversation today on a highly topical issue. My goodness, in Washington, just yesterday, a whistleblower from Facebook, as you may have heard in the news, was providing documented evidence that Facebook, which owns Instagram, was putting corporate profits over the health of teenage girls in particular. And part of the broadcast, to Yvonne's point, that I saw, I had a number of teenage girls talking about what it was like being on Instagram and how at one level, they loved it and they could follow, but at another level, they were oppressed by the images that they were seeing, that they looked at their own little bodies and realized they didn't kind of match up. And so what do? Do you start using Botox? Do you have plastic surgery? I mean, there was a very powerful dialogue about the issues that have been raised today. And so I just wanted to underscore its topicality and its direct relevance to millions of people around the world, that these issues may seem philosophical while we're discussing them, but they're affecting real people's lives in very profound ways. And this whole internet, Facebook, are unprecedented frontiers for the human exploration into reality, and how we evaluate it and how we assess, hopefully through the precautionary principle, how best to proceed, given the delicacy of the moment, is the task for all of us, not only the governments and the major corporations, but also the general public. So thank you, all of you, very much for this dialogue today. Very, very illuminating. And then tomorrow, everyone, we'll be exploring a related issue of health, and that is, innovative approaches to kidney-related diseases, which are on the rise globally, as many of you know. So that'll be tomorrow on Humanity Rising, same time, same station. But David, Lars, Jonathan, Yvonne, thank you for a very inspiring session today. Thank you, everyone.
For having me. Bye.
With pleasure. Hope to see you the next time I'm in Vienna.
Yeah, that would be great.
I'll take you to the statue.
Yeah, you have to.
Bye, everyone. See you tomorrow.
Thanks a lot.
Bye for now.